Thank you. Bismillah ar-Rahman ar-Rahim. Good morning, ladies and gentlemen. It's really great to be with you today, GH employees, their families, and entire society. Today, the presentation is about the role of nutrition for kidney health. In fact, we are approaching now the World Kidney Day of March 11, and this occasion is really a strong reminder for all of us to adapt a healthy lifestyle and to care about our kidneys for now and for the future. In fact, it's an excellent opportunity for us to assess where we stand from our kidney health and take actions accordingly. For today, I'm going to highlight more about how much we should appreciate our kidneys for our healthy life. What are really the kidneys doing for the great job? Then I will also talk about the role of nutrition in keeping the kidneys functioning well, healthy, and safe. Then I'll leave you with some take-home messages. This year, in fact, ladies and gentlemen, the World Kidney Day of March 11 is telling us that really we have to care about our kidneys. And to care about our kidneys, to keep them functioning well, we can avoid many, many diseases. For example, the guidelines for kidney health are benefiting the hearts, the brains, and the bones. In addition, that would reduce also the risk of cancer and many other diseases. So this is an excellent investment in the kidney health and in all the organs and body parts. The theme for this year is very inspiring, very emotional, and also it makes the people taking action. Kidney health for everyone, everywhere. It doesn't differentiate the ages. So children, adolescents, adults, and elders, every single person to care about his or her kidney. And everywhere, whether at home, at work, while we travel, any place, we should care about our kidneys. And we aim in this program to increase the awareness of the individuals about how much the kidneys are important for our health. In addition, what are the burdens for the kidney diseases and what we can do to avoid those risks that would cause kidney failure. From appreciation of our kidneys, how much great job they do. They do a lot of good things for ourselves, as we said. So the first important function of the kidneys is that they filter the blood. They keep the blood clean, and also they get rid of all the waste and all other, in fact, materials that the body does not need. They balance the fluids in the body, in addition to the electrolytes and minerals. So they support the fluids, electrolytes, and minerals to be within normal range. In addition, kidneys secrete hormones that are important for life. So it's not only kidneys for filtering blood and getting rid of waste. They do lots of good things for the body, and also they support the bones to be healthy and strong. They support the immunity, and they regulate the blood pressure within normal range. See, ladies and gentlemen, how much we always appreciate the importance for our kidneys, for our health now, and as well as for future, for every single individual in his life. Nutrition plays a major role in keeping the kidneys functioning and keeping the kidneys healthy. Too many, in fact, factors, as I stated, when we will consume healthy and well-balanced meals, we support the kidneys to function well. In addition, we support our brains, we support our hearts, and our life, generally speaking, and in fact, strengthen our immunity as well. So how we can eat healthy and well-balanced meal? We have here an image for what is called my plate. So we consume like half of our plates of fruits and vegetables. Then we have whole grains, and we have here protein, and the protein can be divided into plant and animal protein. Then we have dairy products, we have fluids, and we have healthy oils. This is what does it mean for well-balanced meals. So for fruits and vegetables, they are fighting cancer, and also they are good for the digestive system, good for the brain and for the hearts, as well as for the kidneys. And in fact, they contain lots of vitamins, minerals, and antioxidants. Whole grains having fiber, and they provide the body with lots of, in fact, vitamins and minerals. In addition, we do prefer the carbohydrates to be healthy and to limit the sugary and sweets. For the protein, as we stated, this is to maintain the muscles and the immunity, but not to excessively consume red meat, and we can balance the protein between animals and plant protein. We add water always with the plate. We add low fat or non-fat dairy products. It's better to use low fat or non-fat rather than, in fact, fully cream dairy products. Important for calcium and for vitamin D. And not to forget that in the middle of the plate, there's healthy oils or unsalted nuts that would be good for the brains as well as for the kidneys and the heart, and provide a body with essential fatty acids and fat soluble vitamins. This is, generally speaking, my plate or the well balanced meals. But not to forget that when we will limit the sugar, we should limit, in fact, the excessive use of salt. Salt hurts the kidneys, tends to increase blood pressure for many people. Salt affects the bones. We don't need really to add that much of salt. In fact, the natural salt available in the food enough for the body requirements. In addition to limiting the salt, to limit the intake of the junk food, salted items, salted nuts, and any commercial dressings or sauces and pickles. If we would go for, in fact, be cautious about the salt, we can benefit the kidneys as well as benefiting the brains and benefiting the hearts and all the organs of the body. In addition to the balanced meals and be cautious about the salts, we should understand, ladies and gentlemen, that there is a connection, a link in the work between heart and the kidneys. So if we are after our hearts to be functioning well and to be safe, it is linked to the kidneys, meaning we limited the salt, we control the blood pressure and the blood sugar, that is excellent. In addition, we limit the saturated fats such as animal fat and the fat available in dairy products, as well as the trans fat that available in some food items such as ice cream or cookies. This is not healthy. Okay, now our hearts are functioning well. Our circulatory system functioning well means that enough blood are going to our kidneys to support their functions very well. So we limit as well any fatty cuts of meat, burgers, junk food, fully cream dairy products, fatty desserts. We replace them by healthy sweets or by fruits and any unhealthy pastries. So we care about our kidneys from this aspect as well as for our hearts and our brains. The protein requirements for the body is very well calculated. So we always require protein to be almost zero point 0.8 grams per kilogram body weight, maximum 1 gram protein per kilogram of the ideal body weight, not our actual weight. So if my weight is, let us say 70 and my ideal body weight is 60, I suppose not to consume 70 grams, I suppose to consume 60 or even 55 grams per day. And I stated, as I stated earlier, we in fact balance the protein to be half of it from animal sources and the other half from plant sources. So we should avoid consuming that much of protein from the meat or even from dairy products, because that much of protein, if we consume it, it would affect the kidney functions. In addition to the protein, we should remember something to avoid dehydration. Dehydration is not that good for the kidneys. In fact, dehydration is not good for all the body parts. So we need to be hydrated, but we should not wait for feeling thirsty in order to go and drink water. We're supposed to drink water regularly. Let us take 8 cups per day. Let us divide this water between all the meals from morning to evenings in order to have our bodies hydrated and enough fluids going to the kidneys to avoid any deterioration or negative impact of dehydration on the kidney function. Now, another important topic that supports kidney health, the normal body weight or the healthy body weight. Overweight or obesity are risk factors for kidney deterioration. They will increase the workload on the kidneys. In addition, they would affect the heart, they would affect the brains and increase the risk of high blood pressure and also some cancers and also stroke. So in order to keep our kidneys normally functioning, we should keep our body weight within the normal range. If we have extra body weight, we consult our doctors and dietitians to give us the best program that is healthy and approved, and not to go to any, in fact, social media unapproved body weight management programs that may hurt us and may hurt our bodies. We spoke before a while how important our hearts to function and our circulatory system to function in fact, in connection to our kidneys. So we need healthy diet, we need enough fluids, but we need also exercise. Exercise for the muscles, exercise for the heart, and for also the blood, and this would make enough blood flow to the kidneys. What kind of exercise? We need exercise to be regular. Not I will go to gym like once a week for 2 to 3 hours, then I don't do any exercise for the remaining days. This is unhealthy. So regular meaning like every day or every other day. If I will go for 30 to 45 minutes, this is excellent. 150 minutes per week, this is the minimum. We can make it 200 or 250 minutes per week, but divided all over the 7 days or 5 days a week. And we can make it safe. Brisk walking, this is very good, and we take water before, during, and after. By this, we can keep our blood circulation healthy for our kidneys and also for our hearts and for all the organs of the body. What other factors we need to consider? We spoke about hydration, the circulation, avoid that much of protein, limit the salt, saturated fat, etc. So we need as well as to check our blood sugar and pressure in addition to the lipids. Because if our blood sugar is high, it would affect the kidney function. If it is our blood pressure is high, also it would affect and lipids. So we need to do medical checkup, visit the clinics, do all these tests in coordination with the physicians, and make sure that our blood sugar, blood pressure, and lipids are within normal. And to avoid having these into the higher range, we need to keep them, in fact, within normal range for the blood sugar and the blood pressure, and also for the cholesterol, triglycerides, and other kinds of the lipids. This is very, very important. Diet can help, exercise can help, and following, in fact, certain lifestyle modifications, losing weight for obese, all these factors are excellent. And if our bodies would need medications prescribed by physicians, we should go for the medications as well. The goal here is to keep the blood pressure, blood sugar, and the lipids within normal, to keep the kidneys functioning well and to limit the risk factors. Now, another topic as well, so important. We should not, under any condition, go and for unprescribed medications or even supplements or even herbs, painkillers, any medications that are not prescribed by physicians, we should avoid. We should not go to any pharmacy or any, in fact, herbal center or any place and to purchase over-the-counter pills or even vitamins or minerals or even protein drinks or protein powder without consulting the doctors and the dietitians and the pharmacists in this aspect. Too many, I would say, unprescribed medication can hurt the kidneys, can affect the immunity, can affect the heart and the brain, and can cause lots of unhealthy conditions to all the body parts. So kindly remember this, ladies and gentlemen, that if we are after a healthy life or healthy kidneys, we should be aware about this important topic and not to take any unprescribed medications or supplements, even if something mentioned in the social media without medical approval from accredited resources, we should avoid. Food poisoning is another, in fact, negative matter that affects the healthy, affects also the immunity, the bones, the brains, all the body parts. Why is that? If people are getting food poisoning, they are getting something not good for the body. There will be infection, and infection would affect the kidneys. in also affecting the immunity. So we should always consume safe and healthy food. If we doubt any food that is not safe, we shouldn't eat it at all. And also, when we practice shopping, it should be safe. When we practice cooking, should be safe. If we go and dine out, we should be very careful that the food we consume is safe. We keep the food in the refrigerator, we cook it at right temperature, and we consume portions adequately. We wash our hands, so we make sure that the eating environment in the kitchen or the cafeteria always clean and sanitize, washing hands for 40 to 60 seconds with soap and water. This is very, very important, and to teach our children, our friends, all of us to care about it. There are other, in fact, factors affecting our kidney health for now and for future. Smoking, actively or passively, affects the blood, affects the hearts, the brains, and the kidneys. It would reduce in fact, the blood flow to the kidneys, increase the risk of cancers in the kidneys and all the body. So we should be aware about all this of active and passive smoking and avoid them in addition to any alcoholic drinks. Silent diseases are really affecting our health. So medical checkup is so important. Silent disease such as diabetes, such as obesity, high blood pressure, without signs and symptoms in the early stages of those silent diseases. So how we can, in fact, catch up the silent diseases and prevent their impacts negatively on the body, all the organs, including the kidneys, by doing our regular medical checkup and take the advice of the physicians. We should also listen to our bodies and observe. For example, if we will have any signs or symptoms reflected on our bodies for kidney failure or kidney impacts, please don't wait. Go and report it to your doctors. If you notice a swelling in the feet or ankles or the urination frequency change, the volume change, becoming less or more, feeling nauseated or vomiting or muscle cramps or abdominal pain, something unusual, kindly don't ignore. Go and report it in a timely manner. Don't wait. These are, in fact, signs and symptoms for could be kidney failure in the early stages that can be treated. We should not ignore these signs and symptoms, and we should report it to physicians as immediate as possible. By this, we understand how much important our kidneys for our life, not our life for now and for the future. We understand the good factors that we need to consider for our kidneys to functioning very well. And also, when we care about our kidneys, we care about our brains and our hearts and our bones through nutrition, through exercise, avoid obesity, eating healthy, doing exercise, as well as avoiding obesity and also salt intake and sugar, all that matter. By eating well, this would support kidney functions. By being active regularly and moderately, this is also good for our kidneys and all the body parts. The end of this, that we will be well for now and for future. This is exactly the theme of the World Kidney Day for this year, that everyone, children, adolescents, adults, and elders, everywhere, at work, at home, at other places, we care about our kidneys. When we go to supermarket to shop, we remember our kidneys. So we, in fact, purchase safe food and with less salt and with less sugar and to be healthy. When we go for cooking, we cook healthy for our kidneys. And when we dine out, this is very, very important. Being well for, as we said, kidneys and all the body parts. And by this, let us please remember that the World Kidney Day is a reminder for us to care about our kidneys, and also to remember that our kidneys should stay functioning well and safe for all our life. I'd like to thank you very much for listening, and please take this opportunity to appreciate our kidneys, to care about them, and if we would be noticing any deterioration or even any signs and symptoms in our bodies, in our urination, in something unusual, kindly report it to your doctors and don't wait, because all those factors negatively affecting the kidneys or positively, they are very important. They matter for our health. Thank you very much and bless you.